It gives me a great pleasure to introduce Dr. Josephson, who is the professor of medicine and surgery at the University of Chicago.
Well, thank you so much. A couple of things. One is thank you so much for that kind introduction. That was really nice. The other thing is I just want to say that I'm so happy to be here today. I guess it depends where you are. It may not be this morning, but today with everyone. And I'm excited to be here to talk about transplant pregnancy, which has been an interest of mine for so many years. So today I'm going to tell you a story really in three parts about transplant and pregnancy, and I certainly hope that we have time at the end for questions. So, so the way I'm going to break this topic up is to talk about first the effect of pregnancy on the allograft, and then I'm going to talk about the impact of the allograft on pregnancy, and I'll finally Chapter 3 of our talk today is going to be about preeclampsia after living donation. And all three of these areas sort of come together under the big topic of transplant and pregnancy. But before I jump into those three areas, I just want to give some historic perspective. And in order to do so, I want to start with this really wonderful picture, which I think of as a tale of two twins. Now, I date this picture, I'm just going to make this up. I don't know exactly, but I have reason to believe that it's probably about 1963. So let's say 60 years ago. So this is an old picture. And you see these two women here in the picture who look very similar. On the left, this is Edith Helm. Now, Edith plays a special role in the history of transplant because she was the third person to have a kidney transplant from Dr. Joseph Murray, the Nobel Prize award-winning surgeon. And she received her kidney from her identical twin, Wanda Foster. She was also the first woman to receive a transplant. She received her kidney transplant in 1958. Now, what you notice here is that these two women are sitting with a bunch of kids. And you see Edith here with her son, who was born in 1958. So now he's about 65, and daughter who was born a couple of years after. And her sister Wanda, who's sitting there with three of the four boys that she had after she donated a kidney. Now, there's a lot of really wonderful stories about these two. I'll tell you one in just a few minutes. But for this moment in time, we're going to focus our attention on the left side of the panel, and we're going to talk about Edith's story. And I think one of the things I do want you to notice is that these two children look very healthy. That's something to be aware of. Now, Edith Helm's legacy, aside from being the first woman to receive a kidney transplant and being a pioneer in that regard, is that she was the first person to have a kidney transplant and become pregnant. And she really made clear that women with transplants can become pregnant and deliver healthy babies. Now, my little funny story, and this is a true story, is that at the time that Edith was pregnant, Dr. Murray's wife was also pregnant. It turns out Edith lived in Kansas, and the surgery obviously had been done in Boston. Dr. Murray asked Edith to come back to Boston because, you know, this was a high-risk situation to be under observation, and she spent much of her pregnancy in the hospital being watched until she was delivered by C-section. The story is that at least one point during Edith's hospitalization, Dr. Murray's wife was also in the hospital, and Dr. Murray's wife is none too happy because although she was delivering one of their children, Dr. Murray was spending more time at Edith's bedside than he was at his wife's bedside out of concern. But anyway, apparently that is a true story. But, you know, I think we have to put this in perspective because I did mention that Edith received her kidney from an identical twin, was not on immunosuppression consequently, and we know that most of the women who get kidney transplants are. And so when we think about what has happened to the women who came after Edith, all of those decades after, when most of the women were on immunosuppression, I think this really brings a number of issues that we have to consider when we think about transplant and pregnancy. And so I just want to give you a sense as we look at this first chapter, what we're going to be touching on. We're going to be looking at issues.